Well, today we're shedding light on a challenge that many cancer patients face, but it's rarely talked about: changes in taste due to treatment. Studies show that nearly 80% of cancer patients experience taste changes or alterations, which can make eating a struggle and impact overall nutrition. A new educational campaign called Tasting Notes is stepping in to help. Joining us today is registered dietitian Abby Reiser, who specializes in oncology nutrition and is here to help cancer patients navigate these changes and rediscover the joy of eating again. Hi, Abby. It's good to have you here.
Hi, Cheryl. Thanks for having me. I'm thrilled to be here to discuss tasting notes.
So, can you explain why cancer treatments often cause these taste changes?
Absolutely. Taste, touch, and smell are experienced when sensory cells in the mouth or nose send signals to the brain, and many cancer treatments can interfere with the function of those cells. In addition, some treatments can also damage the nerves that send taste signals to the brain.
Okay. Well, I know sometimes cancer patients have a tendency to lose a lot of weight. Is that because they're not eating like they should?
That's often the case. Weight loss is a really common side effect of treatment as well. And taste changes can definitely lead to decreased appetite and weight loss.
Sure. Well, it makes sense. So, why is maintaining proper nutrition so critical for cancer patients, and what kind of struggles do they have to eat well?
Eating well during treatment is critical. It increases the likelihood that a patient will maintain their strength, their energy, and their weight. And weight maintenance is especially important while in treatment because if a patient loses too much weight too quickly, the medical team may need to reduce the dosage of the treatment or even hold the treatment. Proper nutrition also has the potential to boost their immune systems, help them fight infection, and to help them better tolerate treatment-related side effects.
So, can you tell us about the Tasting Notes campaign? What inspired it, and what kind of resources does it offer to those that are taking cancer treatments?
Yes, the Tasting Notes campaign, which was created by Johnson & Johnson, who I'm here in partnership with today, was inspired by the fact that taste changes is one of the most common side effects of treatment, yet one of the most difficult to manage because everyone's experience with it is different, and there's really no one size fits all. So on the Tasting Notes website, which is gettastingnotes.com, you'll find a tip sheet with nutrition recommendations to help prevent weight loss, as well as recipes that are specifically designed for patients who are experiencing taste changes. In addition to the tip sheet, there's also a 3-part video series, which features myself and world-renowned chef and cancer survivor Grant Achatz. And together we deep dive into taste changes, and all in an effort to make patients realize that they are not alone in this.
You know, I've often heard that it's more important than ever for people who are undergoing cancer treatments. It's more important than ever for them to eat well because that's what helps their stamina and helps them heal. And you know, when you don't taste anything or nothing tastes good, it's hard.
That's exactly right. Oftentimes we will see patients lose weight due to the side effects that they experience. And one of my main jobs as a dietitian that specializes in oncology is to help prevent unintentional weight loss. So a lot of it involves brainstorming and offering different tips to help maintain their weight.
So, where can cancer patients and their caregivers go to find more information about the Tasting Notes campaign and support for taste changes?
Cancer patients and their caregivers can find more information on the Tasting Notes website, which is gettastingnotes.com.
Okay. Well, Abby, it was a real pleasure visiting with you today. And this is important information because for people who are undergoing cancer treatments, life is not comfortable. And If, well, because nothing tastes good, then it's even more uncomfortable.
Absolutely. Thank you so much for your time and for allowing us the opportunity to spread awareness on this.
Okay. And we'll be back with more.